So, what does the word infarction actually mean? In fact, the word infarction means tissue death, but in Latin, tissue death is called necrosis. Necrosis. So it should actually be called myocardial necrosis. But the thing is, necrosis of muscle tissue, of muscle, is referred to by the word infarction. There can be an infarction of muscle, and there can also be an infarction of, say, the intestine when the muscular wall is affected. And that's where the term myocardial infarction comes from. Essentially, it means tissue death. What you see in the picture is the death of a section of heart muscle, and most often this happens due to impaired blood circulation. Well, as examples of this, it can happen when a person's blood thickens, or when someone has, for instance, atrial fibrillation, where the blood swirls around the heart valves. In such cases, blood clots form. These clots can immediately enter a small opening nearby the coronary artery, and then such a clot can block the vessel, causing a thrombotic myocardial infarction. As a result, there is necrosis of the heart muscle, tissue death, and the weakening of the heart's function itself. But often, friends, there is another situation when a heart attack occurs against the background of angina. Let's figure out what this is. This situation develops as follows. When a person, remember, we recently discussed the topic of atherosclerosis. When a person's coronary arteries are clogged with atherosclerosis, and for example, the lumen of a coronary artery is narrowed by a certain percentage. When a coronary angiography is performed, it is possible to determine the degree to which the coronary arteries or their branches are clogged, and they identify stenosis at 30, 50, 70%, or whatever is found. In this situation, when a person has a certain degree of blockage or obstruction in the coronary arteries, some kind of stress also occurs. That is, the factor that usually causes angina is tension exertional angina. Sometimes it can also occur at rest. But when there is some kind of physical exertion, when stress occurs as a result of this tension or stress, adrenaline is released in the adrenal glands. And what does adrenaline do to our blood vessels? That's right, it constricts them. So the vessel was already clogged, the vessel was already barely passable. And under the influence of adrenaline, the spasm of the vessels causes even more blockage, further reducing blood flow. Well, most often it's not the entire heart, not the whole coronary artery, but one of the branches of the coronary arteries. And as a result, blood immediately starts flowing poorly to that part of the heart. And this is exactly how an angina attack occurs. What is that? It's a severe pain behind the breastbone, which makes a person feel as if their heart is being squeezed. A sharp, intense pain in the heart area, sudden weakness. The person wants to sit down, to bend over, to curl up. It's not for nothing that it's called angina pectoris, or literally chest toad. Why chest toad? In a poetic sense, it feels as if something is pressing down on the chest, preventing the heart from contracting, stopping the heart from working. As the golden rule in treating angina, it is absolutely necessary to stop the attack. To stop it means to eliminate it, to remove the cause. So medications are used that have a vasodilating effect. This includes the well-known drug for you, Validol. Well, Validol in essence is valerian and menthol, which cause irritation, and it is taken sublingually. They irritate the mucous membrane of the tongue. But what happens is a reflex between the blood vessels and the mucous membrane in the oral cavity under the tongue. That is, the vessels under the tongue dilate, and reflexively, the coronary arteries also dilate. Blood flows to the heart area and the attack subsides. Sometimes people take, let's say, stronger medications. Nitroglycerin. Nitro means nitrogen, and glycerin is fat-based. And nitroglycerin nitrogen compounds always cause the blood vessel walls to dilate. Nitrogen always relieves vascular spasms. Well, and from nitroglycerin, from taking this medication, the blood vessels in the mucous membrane of the mouth also dilate, and immediately the same dilation occurs in the coronary arteries of the heart. Yes, simply taking nitroglycerin or Validol leads to the dilation of spasmed blood vessels, improves blood flow to the heart, and the angina attack ends. But if the angina attack is not relieved, then because of this spasm, a catastrophe occurs in the heart area, since in this case a part of the heart does not receive blood supply and the cells begin first. They lose their functionality, meaning they can no longer produce the contractions needed to pump blood, the contractions of the heart. Subsequently, the death and necrosis of myocardial cells occurs, accompanied by severe pain, weakening of the myocardium itself, and reduced conductivity in this organ. As a result, the typical signs that characterize a myocardial infarction essentially appear. A feeling of fatigue, weakness, and possibly loss of consciousness may occur because the heart stops pumping blood adequately throughout the body and blood does not reach the brain. Dizziness can also occur at this point. Autonomic reactions will appear immediately. This may include cold sweat, as well as disturbances in the digestive system, severe, sharp, pressing pain. The pain may radiate to the left arm, the left shoulder, or even to the stomach area, sometimes resembling gastrointestinal problems, especially in certain types of heart attacks with specific. And essentially, there may be arrhythmia, immediate rhythm disturbances, and a variety of painful sensations that can radiate to the spine and may spread throughout the entire body. In essence, a myocardial infarction is a catastrophic situation that manifests as the death of a portion of the heart. There are several types of infarction depending on which vessel this catastrophe occurred in. It could be an infarction of the tip of the heart or of the left ventricle or even the right ventricle. Sometimes it affects the septum of the heart. They vary in terms of localization. Essentially, I don't particularly focus on this point because an infarction is an infarction. It's catastrophic in terms of its negative impact on the heart and on the body as a whole. And there isn't really a fundamental difference between an apical infarction and a septal infarction. Only the consequences may differ. And basically, when we are dealing with a condition like an infarction, for its diagnosis, for determining the infarction itself, its location, its age, ultimately, the determining tool is the cardiogram. That is, electrocardiography is the gold standard for identifying myocardial infarction. They look for a downward Q, an upward R, and then the S should go downward. This is the standard flag that you see. It's the elevated ST, this kind of raised platform. Well, I think maybe someday in another video I'll tell you a few more secrets and features that relate to the cardiogram in general. But this typical ST flag, by the way, changes depending on the stage of the infarction. At first, it may appear as a pronounced elevation and then later as a decrease and so on. Friends, now is not the time to go into detail about this. The main thing is when it comes to the onset of a heart attack and severe chest pain, the only thing you need to do is simply get an ECG. And basically, based on the ECG interpretation, the doctor will determine the next steps. We can confuse a heart attack with intercostal neuralgia. It can also cause pain in the area to the left of the sternum, but with intercostal neuralgia, there will be no changes on the ECG. If, however, we see ECG changes that are typical for myocardial infarction, then to confirm this in a general blood test or even more so in a biochemical blood test, we may see an increase in the CPK indicator, creatine phosphokinase. Creatine phosphokinase is an enzyme found in muscle tissue. When this tissue breaks down, these muscle components enter the bloodstream, and we can detect them, their creatine, for example, and we can see them in the blood. If we observe an elevated CPK level in a person with a heart attack, this serves as yet another confirmation that the pathological process is indeed a myocardial infarction. What needs to be done? Guys, the first thing that needs to be done is urgent emergency hospitalization. Many people are probably thinking right now that Dr. Golot is going to start talking about turmanium ceramics. Guys, there can be absolutely no talk of any turmanium ceramics. Let's break it down. And the treatment for myocardial infarction follows the MONA principle. What is mono? That's what I'm going to talk about now. And the first is M. M stands for morphine. M is morphine. Well, someday I think I'll prepare a separate video specifically about painkillers, because there are many different kinds and they can act on different mechanisms to relieve a person's pain. And one of the standards, the golden rule of pain relief in critical conditions, for example, a gunshot wound, a severe condition like a fracture with damage or amputation of a limb, and also in cases of severe pain, such as pain shock during a heart attack, is that narcotic drugs like morphine are predominantly used as painkillers. It might seem surprising, but yes, morphine is prescribed specifically for people with myocardial infarction. Morphine itself does not, this is the key point, French morphine does not provide a true pain relieving effect. Morphine acts on the central nervous system, altering a person's perception of the pain they are experiencing. This is a unique feature. This is a characteristic of narcotic painkillers. And that's why, in this case, to avoid causing severe stress in the patient, since stress will be accompanied by the release of adrenaline and will further intensify the pathological process in an already diseased heart. So in order to eliminate this psychological impact of severe pain, yes, exactly, any means of pain relief are used, including morphine. Even morphine, because yes, it acts on the nervous system, causing corresponding changes in the psyche, altering a person's perception of pain more than actually removing the pain itself. But this is a necessary factor. We, as it were, make this decision in order to eliminate what is primarily caused by the person's own condition during a heart attack. This is morphine. The second component, O, is oxygen. Do you understand the point? After a portion of the heart tissue dies, the heart becomes less effective at pumping blood. And because of this, hypoxia occurs. Hypoxia means suffering from a lack of oxygen, and oxygen is vital and energetically essential for all organs, for every cell in our body. And the heart, like a little motor, starts pumping worse and worse, so all organs suffer from oxygen deprivation, with the brain being affected first and foremost. And in order to somehow improve oxygenation, to provide more oxygen, we increase the amount of oxygen in the air the person breathes in. In other words, this means we let them breathe oxygen, increasing the percentage of oxygen in the inhaled air. A higher percentage of oxygen will be present in the alveolar air in the lungs, and more oxygen will enter the blood, increasing the blood's oxygen saturation under conditions where blood flow is generally impaired. At the very least, this allows us to slightly improve the oxygen saturation of all organs during the development of a myocardial infarction. So oxygen must be administered under the nose. Third is N. That stands for nitrogen nitrates. These are nitrate medications. Nitroglycerin, isosorbide nitrate. In short, nitrates are medications that are administered immediately. What do nitrates do? They cause the muscular wall to relax, dilate the blood vessels, and improve the blood supply to the heart. That is, nitrates are administered from the very first second or minute of a heart attack, and this also helps partially limit the area of necrosis and reduce the symptoms. And that's why in the case of a heart attack, just as nitroglycerin is used for angina, nitrates are also used for an already developed heart attack in order to, let's say, reduce the size of the actual damage. A stands for aspirin. Well, let's put it this way. You know that I'm rather skeptical about antiplatelet drugs for thinning the blood. After having looked at the blood of thousands and tens of thousands of people under a microscope and seeing how blood thinning actually occurs after taking aspirin, you will never convince me that aspirin thins the blood. Aspirin does not thin the blood. Once again, carefully and slowly. Aspirin does not thin the blood. It is an antiplatelet drug, and while taking aspirin reduces the formation of blood clots, the blood itself does not become thinner. Taking aspirin is reasonable. It reduces the formation of blood clots on the vessel walls and inside the vessel lumen, and that's why taking aspirin is still rational. It's not just about aspirin itself, but about antiplatelet drugs in general, which sometimes include trentol or pentoxifylline that are simply administered intravenously, just given to a person who has had a heart attack. But forgive me, these drugs have nothing to do with thinning the blood. This has been tested, I repeat, on thousands, even tens of thousands of people. For blood thinning, I would suggest the following. All people with heart attacks, strokes, or vascular catastrophes should, from the very first days, from the very first hours of illness, be placed on, lie on, and sleep on the magnetic turmanium mat. I didn't specify whether it should be warm or cold, any kind will do. Even a cold turmanium mat has a magnetic field capable of magnetizing, thinning the blood, improving the rheological flow properties of blood, and enhancing blood supply, at least to some extent, to provide at least a little help in the case of a heart attack. So here, in combination A, you could add just a little bit more specifically the turmanium matan. For now, that's probably all. All other components that we can use to assist in the treatment and rehabilitation of the patient come into play during the recovery period, either early or late recovery after a heart attack. But I repeat, a heart attack is a life-threatening emergency. Therefore, the first treatment, the primary initial treatment for a heart attack is resuscitation measures in order to, well, forgive me, but to save a person's life. That was the information we had for you today. This was today's video specifically about myocardial infarction. Friends, we're not stopping here. In the next video, we'll continue to discuss topics related to the cardiovascular system. We'll also talk about what happens after a person survives a heart attack and doesn't die. But that's all for today. Thank you very much for your attention. As always, I remain with you, Dr. Holod Vladimir Miroslavovich. Goodbye.